we are Hope on the Hard Road nonprofit. We're a special needs nonprofit that supports families with children with special needs of all ages and all diagnoses. And our goal is always to support the family in different ways, various ways. And so these are our monthly parent support groups where we bring in experts in different fields and helpful information to you as a family. So, hi guys. Aw. So we're going to go ahead and get started. So Cheryl Jordan, we are so excited to have her tonight. She is a good friend of ours and also is on our board. And I am going to read a little bit about her. She's a pre-licensed mental health counselor who specializes in helping children, teens, and parents who are experiencing anxiety, depression, and PTSD. Her lived experience with her own two children with ASD and ADHD, depression and anxiety, inform her treatment and give her compassion for families who struggle. She's a licensed PT as well as a mental health counselor and uses the physical medical lens to address chronic pain symptoms related to trauma and mental health distress. She graduated from University with a master's degree in counseling in 2020, and she lives in St. George, Utah now with her sweetheart of 30 years, Rob, and has 2 adult sons. So thank you, Cheryl, for coming, and we'll turn it over to you with that.
Welcome, everyone. I know it's kind of hard and hairy just getting anywhere. So pat yourself on the back for even being here. Good job. I'm going to add to the introduction just by saying that I came to counseling as a professional through the personal experience of seeking lots and lots of help over the years for my 2 children. So I'll probably try to share some experiences as we go along. But I really think that counseling can be useful for everyone. So I almost sound like an evangelist, like everyone needs counseling. Well, I guess I come to that just knowing that we needed it. I needed it. My husband needed it individually. We needed it as parents. We needed it as family. And both of my kids needed it at various stages and ages in their lives and for different types of things. All right. So what I plan on covering is kind of how therapy can help each member of the family and the entire family, when and if to change practitioners, and where some just basic ways to find mental health support. And then if you have questions as I go along, go ahead and put those in the chat, and then I bet you Eric will feed them to me. All right. So I don't know if you can see this. You might have to move our little gallery, but I found this picture of this family in counseling, and I just thought for a second, let's just pause because there's just so much going on in here. It looks like there's maybe a mom, a dad, and a girl. And you kind of see there's space between them. You can tell there's tension. To me, the mom and dad look really concerned. And if you kind of close up, like the dad's face is kind of like he's got the worried lines in his forehead, and the mom is kind of just like leaning like, I don't know what I'm going to do. Like she's almost ready to be out the door. What I wanted to say about this is this feels so uncomfortable. And as a counselor, the role of the counselor is to create safety in this any which way, whether it's only one person or whether it's a family. This is probably the most complicated situation you would get, is a family with multiple members. And so you need somebody who has the expertise to really create safety for each person in the room to make sure that everybody feels safe. All right, moving on. All right. Counseling 101, in my view, there are no quick fixes. So the story I will share, self-disclosure, is when my my kids were probably 3 and 5 years old, I knew that we had some difficulties and we needed help. And I continued to seek counseling and in different forms, different help, mental health support, thinking that, well, this is the thing that we need. If we just get this one thing, then things are gonna turn around. They're gonna get easier. It's gonna get better. And at some point, probably in their mid-teens, when my kids were in their mid-teens, I finally realized, there's not a fix. I'm not going to fix my kids. Not that I would ever say anything was wrong with them to them, but I wanted their life to be easier, better. I wanted their mental health challenges to be resolved. And through the process of getting counseling, I really realized that many things are more of a lifetime battle or a long-term struggle. And so what I did realize is that maybe I needed the work so that I could tolerate the grief, the sadness, the anxiety of, worrying all the time. So in the end, the fix was really me and working on my own reactions and my own ability to tolerate just really hard and difficult situations. And no one signs up for that. I think we're all in the club that no one wanted to join. Like, we didn't think about this being a thing when we were dreaming about our future. And yet, holding space for a little one to throw a tantrum or to be able to do something insanely difficult for them is a beautiful thing. And we grow and they grow through that. So the struggle sometimes has glimmers of, hope or beauty. The thing I wanted to say about counseling, the main thing is the second statement. The relationship between the therapist and the client is where healing really begins and it takes place. It really doesn't matter what approach or what, I'm going to talk about some of the approaches, and people will come in and they'll say, I need this treatment. I need this one thing. My friend told me that this was going to help me and I need it. In reality, if you have a good relationship, if your child has a good relationship with a therapist, that is where the healing takes place, just through that human connection more than anything else. Of course, if you're looking for therapy of a certain kind, trauma therapy, then you need someone who has the training to do that. But the relationship comes first. And then I said about the picture in the last slide, it's really the therapist's job to keep everyone in the room safe. Including, if you're seeking counseling for a child and you're the parent, it's important that your concern for safety for your child is also honored and that they have a safe place to process their own stuff. So we can even talk about that later. There's some limits to confidentiality, but I'm kind of a proponent of children having their person. You as the parent vet that individual and make sure that you feel safe and comfortable with them. And then a lot of good work can be done in that relationship between the child and the therapist. Sometimes they can say things or express things that they're afraid to say to you. And it's not because they're afraid that you're going to hurt them or, something bad is going to happen. But sometimes they're trying really hard to hold it together. Sometimes they know how hard you want something for them. And so having their person that just they can say anything to helps get it off their chest and relieves them of maybe that pressure of trying to, perform for someone else, if that makes sense. And then I'm going to talk about the types of practitioners in the next slide. All right, alphabet soup. So I did not know until I started studying counseling how many vast different approaches and ideas there are within therapy. So I thought I would just touch on a few. So solution-focused therapy is really bringing a problem. My child won't go to sleep. My child won't eat. My child is not getting out of the car. My child won't do math. All of those things are things that we would address in therapy. I want to say one really important thing about problems. Children who won't do something, generally, we're describing a brain function, and it is not defiance for the sake of defiance. It's very often the child cannot. And why can't they? That is the job of, parent and physician and occupational therapist and physical therapist and counselor to chase down the reasons why something won't. But a lot of times that's what brings us into counseling, is like that I have this problem and we need help. We need help with this. So solution focused, nothing wrong with it. It's just a specific reason why you would go into counseling, and it gives you an endpoint. If you just go in, I want to, solve all the trauma that I experienced growing up, that's really not solution focused. That's going to be a very long term. Solution focus is going to be more of a short term. These are our goals. This is what we really want to get out of therapy. And it's great because then therapists and parents are on the same page about what that's going to look like. Age appropriate, super important. So I would say under teenage age, kids don't do great with talk therapy. So you want to find someone who does other approaches to connect with children. It can be play therapy. It can be expressive art therapy. It could even be playing games. And here I will tell a story. My son was about 13, found an awesome therapist that taught me a lot about the brain, neuroscience, and window of tolerance, which is, how much margin your child has before they go into that meltdown. So she taught me a ton. But when I would sit in the waiting room, he would pick out the game of life and they would go in his office and they would play the game of life. And I was like, I don't know what's going on in there. So now on the other side of that, I do know what is going on. And for a 13-year-old boy to be able to talk to someone, it cannot be, let's sit on the couch and have tell me, how are things? How do you feel? They're limited to one syllable answers. And so brilliantly, this therapist used his favorite board game, and I think he opened up to her. So that's really important to remember, just that, and ask if the therapist is doing things like, it seems like all they're doing is playing games, or all they're doing is painting or playing in the sand. Definitely ask, what is it that you're seeing? What lens are you using? What are you trying to do with this modality? All right. So third thing, talk therapy and cognitive based approaches. And then many of you may know behavioral, the ABA therapy. This is all behavioral approach. And when I say behavioral, you see a behavior, and often behaviors are connected to feelings, emotions, and actions, feelings, and thoughts. So I'll give kind of a good example just to kind of break that down. So you have, this would be in maybe a more neurotypical situation. You have a kid in middle school or elementary school. They walk into the lunchroom and they are going toward all of their friends. And as they're walking toward their friends, they see everyone is whispering, laughing, and pointing at them, right? So what's the feeling? So you'd ask a kid, what's the feeling? Well, I think they're laughing at me and I'm afraid. So what do you do? Well, you probably don't go sit with them at lunch, right? You avoid that situation. So that's your triangle of the thought, the feeling, and the action. So if you change one of those, the thought, the action, or the feeling, sometimes something will change. So then you would kind of challenge that. Well, what happened that day? Oh, well, there was show and tell, and I brought my dad brought my golden retriever in for the kids to see, my service dog. Oh, okay. So what would be another idea of something that kids could be talking about, right? So you challenge that thought, like maybe they were all laughing because the dog was so cute. And if that's what you thought, that, oh, they're laughing because my dog was so cute, how do you feel? You no longer feel worried, you feel excited, and you do want to go and join that group. So that's just an idea. Cognitive behavior, it's super simplistic, but basically cognitive behavioral therapy and some of those other acronyms, DBT and ACT, are all behavioral in nature. So they kind of use our thinking brain. They also help with skills of emotional regulation and giving tools. So whenever I thought of therapy, I thought of tools like ways to breathe or ways to calm down or strategies. That's all the cognitive based stuff, because you have to have your thinking brain online to be able to do a breathing strategy. You have to be able to think like, what am I supposed to do? Oh yeah, my therapist told me I'm supposed to take a hot shower when I get upset, whatever. So that's all, you have to have a thinking brain for that. All right, so that brings us to our next type of therapy, attachment-based therapy. This can be super useful for any age. And the idea is really based in neuroscience. So there's an adage, people don't care how much you know until they know how much you care, right? So caring, that feeling of caring about someone, connects us at a deeper level. And that deeper level is very healing. So it can be healing in marriages. EFT is an emotionally focused therapy for couples, and it's also available for individuals. And there's a really amazing training program for therapists to do EFT in San Diego. So if you're interested, at the end, I will tell you more about that. But that emotionally focused therapy is based in a more emotional approach to therapy. So it's not as much using your thinking brain, it's a little bit more intuitive and emotional. TBRI is a parenting strategy, I want to call it, a mentoring program. It was founded in Texas by a woman who labeled just children who came from hard places, was what she called kids. And she had her name is Karen Purvis. She passed away a few years ago, but she had a gentle, very gifted heart toward children. And she developed a program and a whole approach that is based on that attachment science of meeting a child's needs. So, Connie, what you were talking about with your daughter having not eaten and not slept, trying to connect the child with the basic needs first, and then once they're calmed in that realm, then we can start doing more correction and more teaching. But basically, so when I was talking about the thinking brain, when we haven't eaten, when we haven't slept, and this is not just kids, this is us too, right? We're no good. We have very little margin to tolerate things. So the attachment-based approach taught me how to address my child who was constantly melting down, flipping his lid, gone in the cognitive sense. He just wasn't there. So attachment-based. Trauma-focused therapy can be for any age, 3 and up can receive treatment for trauma. What is trauma? The gist of trauma is a sudden, scary event that scares the person to the point where they think they could die. So that could be different for a 3-year-old. They might not die. They might not even come close to die. But if they witness their sister fall into a fire, pretty scary, pretty traumatic, right? So, and then everything on up to anything that you could possibly imagine could be trauma. Trauma-focused therapies are, again, a little bit more time limited. They're specific and targeted toward healing trauma. Why would you want to do that? Well, for children, if they're locked in a trauma cycle, it creates the kind of the same neuro patterns as someone with ADHD, very distractible, very emotionally volatile. So if you have a child who has had trauma, then getting them some treatment may help soothe some of those symptoms and smooth out some of those emotional rough patches. For us, grown-ups, parents, if we have experienced trauma, and I'll give you an example. So I have a client, she's a mom, and I was doing some trauma work with her, and she realized that the sound of shattering glass was something that went back into her childhood to about 3 or 4 years old, and it was terrifying for her. And at that moment, she realized, oh, she has 3 kids, and she realized, now I understand. When a glass shatters in the kitchen, I fall apart. So if you find yourself, and so trauma, the response of trauma is that you literally feel like you're in the moment experiencing the thing that is terrible. So it can make no sense. So it is a perfect example, this mom, because she didn't really understand. Like, I don't really know why I react to the broken glass, or actually the noise, the shattering of the glass was the trauma that she experienced. So you can, through these different treatments, you can desensitize your own brain to the sensory components of that. And if anybody's interested, toward the end, we can totally nerd out on the neuroscience and talk more about the sensory and how that's really important. But just in case you don't know what those letters are, so EMDR is an eye movement. It has a really long name, and I'm certified to do it. I just hate the name. So it's basically a way that we can help your brain to remember the trauma and keep you in the room at the same time. So eye movement is the EM, and it really has been debunked that eye movement is necessary. So it's really weird, but the person who founded it was, called it EMDR because that's what they thought at the time. 20 years later, very evidence-based, works perfectly, but it's not the eye movement that works. And so it basically desensitizes your brain and reprocesses a memory and helps it to heal. And then the other 2 that I listed there, trauma-focused CBT is just another treatment, and then exposure is yet another treatment for trauma focus. And then finally on this slide, sorry, this slide is really long. The types of practitioners is really important, and I didn't get this at first. So you have at kind of the top of the training chain, you have MDs who received additional training to become a psychiatrist. And generally their job is to prescribe and manage medications along with psychiatric nurse practitioners. Here in Utah, I guess there are no psychiatrists. So we literally don't have any, I don't even know any prescribing psychiatrists. They're all psychiatric nurse practitioners. But they basically do the same thing. They prescribe and manage medication. Psychologists are on a broad scale from PhD to master's level. If you're dealing with a PhD in psychology, a lot of times they have extra training in assessments. So those are things like assessing for autism and ADHD, doing the intelligence screenings that help us know if our children have learning challenges or delays. And then, so we said psychologist, psychiatrist, then there's basically 4 master's level, we call it master's level trainings that all become therapists. So there's mental health counselors, marriage and family counselors, psychologists at a master's level, and social workers. So just depending, I think California has the most LMFTs. So those are licensed marriage and family therapists. So anyways, just a whole bunch of alphabet soup, just to know that many of these things are different. Master's level generally don't do assessments. Maybe they do 1 or 2 assessments. Psychologists do assessments, and they might also treat some of the mental health stuff. And then psychiatrists generally don't do any of the treatment. They more do the medication management. And then the last thing I wrote on there were mentors. So parent coaches and mentors are also super helpful. They just don't have the master's level and the training behind them. And I don't know if you guys know, probably you do know because of the shortage of therapists, but it is insane how many hours it requires of pre-licensed hours to become a licensed therapist. It's 4,000 in my state, and I think it's close to that in California. So it's just insane. All right. All right. Knowing kind of changing therapists or ending therapy, I think one of the barriers for me, at least, was like, how long does this go on? And how do I know when it's done? So I thought I would just kind of throw this up here, a whole bunch of stuff here. But obviously, if the values do not align, I chose a therapist for my son because he used to be in a profession that my son wanted to be in. And so I thought, wow, he'll get along with this guy great. Well, my values did not align with this particular therapist. And so even though there might have been some good work going on, I became worried that I wasn't really sure where this is that safety piece, right? I wasn't sure where the safety was with this particular therapist. So I thought it better that we would maybe find someone that we both could agree. My son and I could both agree could help us. If a therapist does not address the problem, or maybe they cannot address the problem, go ahead and change. You can break up with your therapist. Before you do, because your child does not want to go, I would say that relationship, you know how I said the relationship between the therapist and the client is most important? It takes a while to build this up with children. The younger the child, sometimes the longer it takes to really get to the point where you're going to talk about the nitty gritty. I have some clients that went through a pretty traumatic incident. The whole family experienced it together. And I think we're going on a year and finally the kids are ready. They feel safe enough in the therapy room to talk about what happened. So that I don't think that there's a barrier there for those children to not want to come, but just know that it should improve. After 2-3 sessions, if your kid is still going, no, I don't want to go, then you need to kind of revisit. Maybe you need to do some parenting sessions with the therapist, or do them together and see what's going on in there, and make sure that the relationship is being established. If there is no progress, we already kind of said that, or if your goals have been met, then feel free to just, we're going to take a break. You can always come back at another time. And one thing that I use is generally if the client comes in every week and they still have things that are going on actively and we're working on things, then weekly is appropriate. If they come in and they're like, I don't really have that much to talk about, or I'm sensing that the goals are starting to wrap up, then let's spread out the visits. Let's see you every other week or once a month for one month, 2 months. And if nothing crops up, then we'll see you later. Call me when you need me. And then the last thing is kind of a long statement, but I thought it was super important. Sometimes problems are really, really big. They're so vast that you're just picking a therapist and a time frame for that therapy just to get you through that specific thing. And so it's okay to just decide, okay, we're done. I've said this, you guys, if you've ever heard me talk, I talk about the whack-a-mole, because whack-a-mole just felt like it was my life. So when you're done pounding on that one problem, another one is going to crop up behind you or to the other side of you. And it's probably another one of your kids, or your husband or your mother-in-law or whatever. So whatever you're pounding on and trying to fix or change, you do that for a little while, and then you might just need to go in a different direction. So giving yourself permission to take a break, even if everything is not all the way done. All right, so sources, really quick. So churches are a great place sometimes to at least give some recommendations. If you are coming from a Christian perspective and you're really concerned about that, I will say that ethically, anyone who is a practitioner is obligated not to try to convince you to change your beliefs. So a good therapist should respect and encourage whatever helps you. If prayer is something that's really helpful to you, no therapist should ever be telling you, that's not effective. If it's very important for you to have a therapist who's praying with you and for you in session, then you're going to want to look for that specialty. Absolutely recommendations from friends, families, teachers, physicians. That's probably where I found the best people. Obviously health insurance, that we know that's a really difficult system to work in, and many of those are impacted and there's long waiting lists. But my theory is if you get on a waiting list today, that's one day sooner than if you wait till next week. So eventually you get seen on a wait list, just sometimes takes a while. NAMI is National Organization for Mental Illness, super awesome organization just for generalized mental health information. It's a nonprofit national organization. So that would be a source for not only finding practitioners, but also finding information. I was just looking at the website today, tons of information on suicidality and self-harm and anxiety and depression and lots of statistics and different resources. So on a national level, super good. Psychology Today would be a good resource for finding a personal practitioner. You can enter in your insurance and what concerns you have in your geographical area and your preference of whether you want telehealth or in person. And you can get a list of people. And I think the practitioners can even say if they are accepting new patients. So even that would be helpful in narrowing down your long list. TBRI, I mentioned it before. There are trained parent practitioners, parent coaches, and then there's also licensed people who do TBRI. And I think it's great for any family that is really struggling with a lot of behaviors. There's no magic bullet, but I think the principles of how they approach a child are really neuroscientifically sound. So they really are based in brain science, and really they work in terms of addressing really problematic behaviors. And then right along with that, Empowered to Connect is a podcast and website that supports parents. A lot of what they talk about might have a lens of adoption, but I also think that it would apply to children with really severe behaviors and parents that are struggling with those behaviors. All right, last slide, you guys. So I started counseling now what to look for. Things should improve slightly within 1 to 3 sessions. If nothing has changed and nothing has gotten better, then I think a conversation with a therapist at least would be in order to kind of find out if we can dial back down to what's most important for you, whatever that problem was. Therapists should really be collaborating. You're all parents, so you should be expressing your goals and what you want to see on a global level, and then collaborating with the therapist to find out how that therapist is working toward those goals. The focus of therapy should really be on providing relationships, the support to those relationships and individuals. And then I mentioned before, sometimes teens and children just have to be seen by themselves.